The small ankle wounds are closed with sutures and a dressing is placed on the skin. You may require crutches for 3 to 5 days, but I allow my patients to put as much weight through their ankle as they wish from day one of surgery. The crutches are only really there for pain relief as required. I don't advise my patients to wear a full moon boot after surgery, and you certainly will not be in a cast or a splint. In both professional athletes and weekend warriors, the best results are seen when we move your ankle early after surgery. In some patients, I may recommend the use of a simple ankle brace with Velcro straps to wear only when walking. Otherwise, it comes off to allow ankle movement. Before you leave hospital, you'll be seen by a physiotherapist who will give you instructions on what you can and cannot do for the first 2 to 3 weeks after surgery. Rehabilitation begins from the day after surgery. You will require 1 to 2 weeks of regular Panadol and anti-inflammatory medication. I'll also provide you with some stronger medication that you can take if and when required. You should make an appointment with your own physiotherapist within 2 to 3 weeks of surgery. If you don't already have a physiotherapist, I can recommend one. It makes sense to see a physiotherapist who is close to where you live or work. Otherwise, you'll be much less likely to see them. You could return to office-based work or study within 1 week of surgery. If you have a manual job, then it may be 2 to 4 weeks before you can return to work. And in that situation, I would recommend wearing a brace for 6 to 8 weeks. From 8 weeks after surgery, a patient can typically begin to gently jog in a straight line. A return to full activities can be 3 to 4 months, but your ankle will continue to improve for 6 or 12 months after surgery. Because I have a special interest in acute ankle injuries, I keep some appointments free every week to see patients who need to be seen quickly. This means I can usually see you within a few days if required, and surgery could be arranged soon after this if necessary. If you'd like to talk to me about your ankle, then please call my rooms at any time to arrange an appointment. If you haven't already had appropriate scans, then I can easily arrange these prior to seeing you.